Hi, my name is Hannah Duke, and I am doing my project on complementary and alternative health options for anxiety. So, what is anxiety? Anxiety is the excessive and enormous worry and fear about situations in everyday life. Panic attacks are episodes of onset worrying and fear that can escalate in just minutes. Anxiety can come in the form of multiple disorders, including generalized anxiety, social anxiety, separation anxiety, or specific fears. Symptoms of anxiety can include nervousness, increased heart rate, hyperventilation, sweating, and trouble sleeping. People suffering from anxiety are urged to see a doctor if the anxiety interferes with everyday life or if it is related to depression, drug use, or suicidal thoughts. Anxiety is often treated with a combination of psychotherapy and medication. The first camp therapy for anxiety is meditation. Meditation is an exercise that employs mindfulness, focus, and tranquility. Meditation usually involves sitting quietly and turning one's focus inward on a person's breathing or feelings. Meditation began in India around 5000 BCE. There are many proven benefits to meditation, including the improvement of physical health, focus, well-being, and self-discipline. Meditation is an attractive option for anxiety sufferers because it is widely accessible, and meditation can calm down anxiety sufferers' worrying thoughts by bringing about a sense of balance. In a 2013 study, mindfulness-based stress reduction was shown to be associated with the reduction of stress in 75% of the measures tested. Most healthcare plans do not cover meditation, but as more awareness is spread of the practice, insurance policies are becoming more inclusive. The second camp therapy for anxiety is yoga. Yoga combines the exercise of meditation with focus on strength, flexibility, and breathing. The practice of yoga is thousands of years old, originating in India. Yoga supports a balanced and healthy lifestyle. Multiple types of yoga are depending on what the person wants to take away from yoga, like Kripalu, Bikram, and Hatha. Yoga has been shown to reduce the impact of stress responses, in turn helping anxiety sufferers not be as reactive to anxiety triggers. Yoga is unfortunately not covered by most insurance providers. Yoga can be a beneficial option for anxiety sufferers because of the inclusiveness of the activity. It can be accommodative or strenuous for the more advanced person. The third camp therapy is acupuncture. Acupuncture is the insertion of tiny needles at specific body points. It is originally used for pain, but is now used for the overall wellness and stress management. Acupuncture is a Chinese practice to balance the body's qi, or life energy, flowing in meridians or pathways throughout the body. Many believe the needles just stimulate the muscle's natural painkillers. A study from 2015 found that acupuncture helped anxiety sufferers who did not respond to other treatments. Many insurance companies will cover acupuncture if it is prescribed by a medical professional. Another 2016 study on rats found acupuncture to reduce anxiety. And acupuncture does this by altering the body's response to the fight or flight sense. The fourth camp therapy is cranial electrotherapy stimulation. Cranial electrotherapy stimulation uses a small device with electrode clips to mildly stimulate the brain. This has been shown to alter neurotransmitter and neurohormone concentrations in the brain. There is still needed research on CES. It is pending a Class 2 status, and the Mental Health America suggests that it needs more clinical trials. CES is a positive option for anxiety sufferers because there are no known side effects and no medication interference. CES, first of all, from studies showing that the stimulation of the brain has the same effect of anxiolytic medications. Due to the lack of clinical trials for CES, an individual must receive a costly treatment through a healthcare provider. This is a Western Cultural Association. The fifth and final camp therapy for anxiety is Rhodiola rosea. This is a root that grows in the mountains of Europe and Asia and is commonly used in a tonic called adaptogen. Adaptogen promotes overall body wellness, strength, and mental and physical endurance. A recent study proved Rhodiola rosea to be beneficial in the treatment of anxiety and other mental health disorders. The use of the root in tonics evolved from the traditional Eurasian medicine. and it is a relatively low cost and available over the counter, making it an attractive and easy option for anxiety sufferers. Previously poorly set up clinical trials of the root gave it a negative reputation in Western culture until more recent and correct studies have been found the benefits of Rhodiola rosacea. And here are my sources.